Imagine you are at a party and the man in front of you falls and collapses to the ground. Everyone around him starts screaming. This man appears to be in cardiac arrest. What do you do? In less than 4 minutes, this man will begin to experience irreversible brain damage unless cardiopulmonary resuscitation is started. Before jumping to action, first make sure that the scene around you is safe. If you have personal protective equipment such as gloves or eye protection, put them on. Get to the victim as quickly as possible and assess the scene. Have people around the victim clear out of the way. Tap the victim and yell, "Hey, hey, are you okay?" If the victim is non-responsive, tell one of the bystanders to quickly call 911. The next step is that you open the airway of the victim. If a neck injury is not suspected, you can use the head tilt chin lift maneuver. To do this, sit at the back of the victim's head, tilt their chin facing upwards, and use your fingers to gently open the victim's mouth. Clear any visual obstructions out of the victim's mouth. If a neck injury is suspected, you can still open their airway by performing the jaw thrust maneuver. To do this, place both of your thumbs on either side of the victim's jaw and gently push it forward. The next thing you need to do is check for signs of breathing. The easiest way to do this is the look, listen, and feel technique. Tilt your head so that your ear is near the victim's mouth. Listen for signs of breathing. Look at their chest to see if it is rising or falling. If you do not hear, feel, or see signs of breathing, you must begin rescue breaths. If you have a two-way breathing valve, utilize it. Once you have your mouth guard in place, gently plug the victim's nose and administer 2 rescue breaths. The chest should rise and fall adequately. Then check for signs of circulation. To do this, place your index finger and middle finger in the groove on the side of their neck, feeling for their trachea. If you do not feel a pulse, you should begin chest compressions immediately. Take your left hand and place it over the top of your right hand. Fold the fingers of your left hand into the spaces between the fingers of your right hand. This will form a nice, tight grip. Then, place the heel of your right hand slightly to the left of the victim's sternum in the center of their chest. Lean forward over the victim and push down on the chest. Administer 15 chest compressions at a rate of 100 compressions per minute. Each compression that you do should make the chest drop 1 to 2 inches. Allow for the chest to rise back up to its original placement in between each compression. After the end of 15 chest compressions, administer 2 more rescue breaths. Then, check for signs of breathing. By this time, EMTs should be arriving on the scene to provide advanced life support to the victim. The 4 cycles of CPR that you will have just administered will have greatly increased the chance of the victim's survival. According to the American Heart Association, 92,000 people in the United States are saved each year by cardiopulmonary resuscitation by a bystander. Unfortunately, only 32% of people that need CPR are administered it by a bystander. In order to prevent unnecessary death and to save the lives of others, it is important for everyone to know how to act in the event of a cardiac emergency. If you find a victim in cardiac arrest, remember the 7 steps of CPR. Assess the scene, call 911, check the airway, check for breathing, check for circulation, then begin chest compressions and rescue breaths. Remembering these 7 steps can help save a stranger's life or the life of a loved one in the event of a cardiac emergency.